first let's stay with the situation in London. Dolin Bhagawati is a neurosurgeon in London and also represents Doctors Association UK, which calls itself the voice of frontline doctors. Dolin, hello, welcome to the programme.
Hi, Tony. Thanks for having me on.
There is. We've heard this message now that this is a crisis point, a boiling point, whatever you want to call it, and there is a temptation on the part of some people to say, "Well, I've not seen it. I've not been in a hospital ward. I can't tell how bad things are." Can you give us your frontline perspective, just how bad things are in London at the moment?
So this is a situation that the NHS has not faced in the past. So we are cancelling all manner of planned care. So we have cancelled our clinics, we have cancelled almost all of our planned operating. In some cases, in some hospitals, cancer care has had to be cancelled. This is because we are running out of beds and we've got strain on the system right from the ambulance services to social care and nursing homes right throughout the NHS. Every part of the system is under strain and is overstretched. We are having to redeploy all of our staff to try and deal with this situation, and in some specialties we are on skeleton services. This is unprecedented in the NHS in peacetime, and I cannot overstate how we have not faced this before. The staff themselves are exhausted, they are working all the hours that God can send, and they are still having more and more people coming in.
Can you spell out in a little more detail how hospitals are actually coping? When you say more are coming in, are wards full and these patients are spilling over into other wards? Are they being transferred to other hospitals? Are they being transferred out of London? How desperate is that situation looking for beds?
So I have to be very clear on this. The idea that we only reach a crisis point when we have patients in corridors on ventilators simply isn't true. We are at a crisis point now. The idea that we would be at this point, if you spoke to anybody in January 2020, would be unthinkable. So we're already at a crisis point now. As things stand, hospitals are working together to transfer patients where there are available facilities when one hospital is unable to provide that service. And the ambulance services and the pre-hospital crews are working excellently to do that. There's a large amount of coordination on the ground from frontline staff to try and make the best of the situation, but this is a massive strain on what's happening. It's not going to be like casualty or ER where you're going to have thousands of people in the corridors fighting over people who are having CPR, but this is a situation where you have all manner of patients on wards primarily, as well as in intensive care, who are requiring a large amount of skilled input by trained staff of all nationalities, and this is getting progressively worse with increased number of cases. The reality of how this affects every single person listening to this is that anybody is one road traffic accident away from requiring an intensive care bed and requiring someone like me to open their head to save their life. If we don't have intensive care beds, if we don't have ward beds, that makes all of this that much more difficult. So I've recently had situations where I've operated on patients and they have waited several days for an ITU bed and had to be cared for in a theatre recovery-like environment because of the strain in our services. Now, frontline staff will cope. That's what they do on a daily basis in all manner of circumstances, and patient care is prioritised, but it is getting harder and harder to do that.
It's a very bleak picture that you paint. Medically and treatment-wise, is there any difference from the first wave in a sense that, anecdotally, I don't know, I'm no specialist, but you hear that there are less people actually on ventilators, more on steroids now. Is there any difference in the way that people are being treated or not?
So we know a lot more about the virus than we did during the first wave when it was a completely new disease and we didn't have treatments. We now do have treatments, as you say, like dexamethasone, and that thankfully does help to stem the tide of deaths that occur as a result of the virus, but necessarily it does mean that people are in hospital for a longer period of time and aren't necessarily going to an intensive care bed, which in some ways is a good thing, but in another realistic way it does also place a strain on the health service. So there are good and bad aspects to an extent of having treatment for this, but it does necessarily strain the service. So, in terms of where we go from here, everybody has a part to play. The primary way we beat this is we try and reduce infections. So, observing the lockdown as much as possible is how everybody can help to defeat this virus. This is a national problem that affects every single person in every single situation.
Do you, just to end, with the combination of this current lockdown and the advent of the vaccines, can you see an end to this crisis or a peak to it at least?
So what we're facing at the moment is we're facing immediate, short, medium and long-term problems in terms of health. Our immediate problem, as has been demonstrated by the Mayor's announcement today, is the ever-increasing rise of the cases of coronavirus in hospital. The short-term issue is getting vaccines sorted. Medium term, we have a large amount of planned care. There are people who are unwell with non-COVID issues, who are sat at home, who are not having their operations and not having their planned care. They will need to be treated in addition to people who will continue to develop other conditions. That is our medium-term problem. Longer term, we will have ever-increasing waiting lists. We have mental health issues already stacking up, and these are problems that are also going to affect the NHS. So we need strategies to deal with this.
Dolin, I was going to say it was a pleasure to talk to you, but not in these circumstances. Thank you very much for your time.